So I was looking for a way to help people with Achilles tendinopathy. And as I was trying to find something that was effective and didn't hurt people, I was looking at your classic things. So shockwave was the big thing that came across. And unfortunately, someone I'd actually referred this lady who was a really hard training lady. I'd sent her off to get some shockwave. And she said after 2 sessions, she couldn't do any more because it was too painful. So I felt really kind of guilty that I'd recommended this thing just because I didn't realize there was anything else out there. So I went on to a couple of actually physiotherapist sites, so Physiopedia, and a couple of other ones to see what the general sense of where evidence was for this kind of tendinopathy treatment. And that's where I first came across using low-level laser. So I then started doing more research. I looked to see what was available in the UK, and I kind of looked at the 3 big ones. And the reason I liked MLS was because of the science-based evidence from the University of Florence, where ASA actually have their research facilities. So that was really great. So I knew that it was science-based. And then the other thing was when I actually had a look at how the laser worked, it was very much do the settings, so scan phase and then treatment phase, and then everything will be fine. So you don't have to think about it too much. If you're happy with your diagnosis, you know what you're going to do, then those 2 things kind of show you like literally where to put it, and they calculate the energy for you. Some of the other companies, you know, you'd have to kind of keep moving the laser so that it didn't burn people and stuff, but because of the technology with MLS, that's not an issue. So it was really looking for effectiveness and safety. And then also a little bit of just making sure I didn't have to, you know, do lots of calculations in my head, and I could just kind of get on with it and start treating people straight away. So when I first approached Celtic, I guess because I'm such a geek, I'd looked at a lot of different research. I'd looked at a lot of the papers to see, you know, where the evidence base was. And so I kind of got in touch with them, and I said, oh, you know, I'm really interested in this laser, you know, tell me all about it. And I was expecting like a big sell. And I spoke to Steve, who's just a marvelous guy. And he was just very straight down the line and said, look, you know, here we go. This is what we can do. Would you like to trial it? And I guess I hadn't really kind of looked at the website too closely for that. I was looking at more of the research stuff. I thought, yeah, trial, that's fantastic. Like, do I put down a deposit? You know what they said? Don't worry about it. They said, you just take the laser and, you know, get it to work with some people and see how you go. And so they're so nice about it. It was really lovely. I didn't really feel there's like a hard sell or anything like that, which I really loved. So then, yeah, I got the laser and kind of looked at it and thought, what am I going to do? And then we had the training with Paul City, who was fantastic. And again, he was just really no nonsense, straight down the line. He said, look, you know, just do your global stuff, you know, do your assessment, do your global stuff, you know, do your directive stuff, just give it a go, you know, work with lots of people, see how it goes. And so I really took that to heart. I was like, so everyone for that first week got the laser. They were like, you know, I was like, oh, you know, do you have anything else going on? So if there's something which I couldn't see that I could use it kind of that comfortably, or I wasn't that sure with, I was just pestering people, and that was great actually, because when you can think about something and, you know, you intellectually believe that something works, that's great. But when you actually see the results, you're like, oh my goodness, this is fantastic. And when people were saying, you know, that pain's disappeared, that's fantastic, that's wonderful. I couldn't believe it. It was wonderful. So as I started to treat more people and my belief kind of grew, I was thinking, yeah, there's no way I'm getting this back. And so I spoke to Steve again. I said, you know, buddy, I really want to kind of to commit to this. And he was very good. He said, okay, yeah, this is what we do. So it was really nice, you know, kind of beginning to end. I felt kind of quite supported. I didn't feel kind of pressured or anything else like that. I had a couple of questions. Again, actually, I had like a follow-up with Paul as well. And so that was really good to kind of just, because I think, you know, you need a little bit of hand-holding as you go through, because it's, you know, it's an unusual process, and it's a fair chunk of change to put in there. But I did feel that actually, you know, this was something which I would be able to help my patients with. And then as I kind of thought of it from a business point of view, I thought, well, you know, hang on a second, this is something which, you know, just does something which I can't see anyone else doing it the same kind of way. So that then helped me to think, like, well, actually, I need to reflect that in the pricing and how I actually get people in. So yes, that was really interesting as well. So being supported as I went through that, both as a practitioner and as a clinic owner, I felt really happy, and that was great. So yeah, I had a really kind of pleasant journey, going from not really knowing what to expect through to being introduced to it, through to then treating people, and then thinking, right, yeah, this is definitely a good fit. So that was wonderful. My favorite MLS laser story was probably with a really wonderful lady who was an artist. So she's been an artist for 30 years or so. She's an art teacher, and so now she's doing all kinds of weird and wonderful and fantastic things. But she was getting Dupuytren's contracture in her right hand, in her painting hand. And she'd had a really tough time over lockdown. She hadn't been able to get any kind of direct treatment or therapy. She was waking up every night with her finger kind of stuck, and she'd have to kind of push it back. It was very painful, and she was so upset because she thought, hang on a second, I'm going to have the surgery. You know, basically they cut into the hand. And they do obviously as good a job as they can, but there's still surgery into the hand, the scar tissue and things like that. And so she thought, crikey, you know, I'm not going to be able to paint as well again. And so she came to me really at her wit's end. She thought, you know, I've heard something from you know, a personal trainer who I treated a while ago, and they said that maybe you could do something. So I said, okay, you know, let's just have a look, let's see what's going on. So we did some other stuff. You know, we looked at her shoulder, we looked at her arm, we looked at everything else, and within 3 treatments over 2 weeks, she had completely reduced nighttime tension. There was no pain. And she was actually back to painting as well. We did a little bit more treatment because she just went full bore. She went straight back into painting. Didn't kind of titrate it back up, and that led to some issues. There was also some other issues with the shoulder, and so it wasn't, you know, the laser completely cured everything and everything was great, but it was, you know, we're able to drop the pain. We're able to change what was actually happening in the forearm, a little bit what was happening in the shoulder as well. We put in some other modalities to make sure that her posture was better, her breathing was better, she was stretching and moving. So it all kind of integrated really seamlessly to make sure that she, about a month after she'd come to see me, was absolutely fine. And that was incredible. I mean, the joy and the relief in her face that, you know, when she came in on that third thing to say, hang on, there's no pain, was absolutely fantastic. And then by the end of the treatment session, when, you know, she was able to do everything and felt super confident and really happy, it just made, you know, I was just so happy. It was wonderful. I suppose my favorite part of having the MLS laser in the clinic is it's always fun to zap people with lasers and to kind of explain how it's all going along and everything works. And you can kind of see them kind of half nodding along. And then when they get up and there's no pain, they go, how does it work again? And you're like, look, we explained it. You know, we actually went through all of this, and you said, yes, you wanted to have it. But it's people just, they can't believe that it works so well. And when you kind of see this, and then you can see this realization behind their eyes that they're like, oh, hang on, you know, this is going to change, things are going to get better. And for me, you know, I'm an absolute sucker for getting people out of suffering and getting them feeling better. So when you see this kind of, it's like a magic trick. It isn't one, of course, but when you see this and you can see they start thinking, oh, yeah, everything's going to be okay. And that deep part of them, which has been a little bit hurt or upset, you know, suddenly starts to think, oh, hang on, you know, I've got a chance here. That's just wonderful. I absolutely love that. So if I was to, you know, be able to speak to anyone that was considering using the laser, I guess I'd want them to, or I'd want to know from them, you know, why they wanted to use it. So I think if they've got the right idea as to what it can do with reducing swelling, speeding up healing, decreasing pain, and the conditions that it can use, whether they want to do, you know, non-diabetic leg ulcers or diabetic leg ulcers, or whether they want to do trigger points or whatever it is, I think if they know how effective it is in the right way, you know, it's not a panacea, it's not a magic wand, then I think you get you know, great results. And the more you use it, the more you can start to work with individual variants, and you can really incorporate it with all kinds of things. So there are patients that I'm seeing which I didn't expect to see, so for rheumatoid arthritis, for example, and being able to help them is so fantastic. I think, you know, you've got to kind of commit to it. It is a little bit of work, and then just making sure that that you're really comfortable with it. When you get all of that kind of stuff, then I'd kind of say, why not? It's crazy not to have that at your disposal, because it speeds things up. There's nothing like it when there's damaged tissue to decrease that swelling, to speed that healing up, and to get people out of pain. And it's that chronic pain which is so difficult to change. When you can really flip that switch in the chronic pain, and you get people who've been in pain for 3 or 4 years with the knee or whatever it is, and suddenly that's gone. It's just so wonderful. And when you can see that, you think, right, why didn't I get this before? So for me, that's the biggest thing. If your expectations are right, and how to use it well, then it's an absolutely invaluable tool. I mean, if I was starting out again, it would be absolutely right up there as one of the things I'd be getting straight off. So yeah, I'd be very, very fulsome in my praise, and tell them to get out there and really do something with it. It's really varied, because there's, if you're thinking about areas of the body, because absolutely tons of stuff with neck, a lot of things with forearm, shoulder, ankle, knee. Those are kind of the big ones that I see the most at. Certainly, I think kind of coming out of lockdown, I think a lot of people have had a lot of issues with lower leg, so sinus tarsi, issues with keeping the arch nice and high, and maybe gait issues as well. So getting in there, decreasing pain, improving healing, that's been absolutely fantastic. As a kind of osteopath who sees a lot of spinal issues, I see a fair amount of that. I think probably the thing that the laser does, which I haven't found anything else to be quite as effective, is when you have super tight scalenes or sternocleidomastoid, and you release off the diaphragm, you make sure the breathing mechanics are good. You can then go in there and get some great results with loosening off that neck, especially if it's really hypertonic, and you don't want to get in there and do manipulations too much, or you don't want to do lots of soft tissue. That can be absolutely fantastic. I'll probably see 2 or 3 forearms a day, and really try and get the whole upper limb working well, so the shoulder as well, of course, and a fair bit of osteoarthritis. So getting decreasing the swelling and getting those joints feeling better. Actually, it's hands and feet, to be fair, is really wonderful to see. So those are probably the main ones. I mean, there's lots of other. There's always contusions and sprains. Yeah, I suppose I see a lot of ankle sprains as well, of course. It is a little bit kind of seasonal, I suppose. So those are the kind of things I'm seeing at the moment at this time of the year. Generally, when people get out and start running again, there's a lot more sprains. So that's what I'd be seeing then. But at the moment, it's probably those guys. So when we're treating an Achilles tendinopathy, obviously we have to look at the case history, and we have to look at the person's structure and mechanics. So as well as doing the usual kind of standing observation, walking and running if necessary, we'll also look to see what actually it's been in the case history, to make sure that we understand why there's been load on that area, and that area hasn't been able to take care of it. Often we'll find that there'll be something going on with the hips, or a collapse in the arch. So as we deal with those, we then take kind of strain out of the area, and then we'll jump on. The way that the MLS works is we have a scan phase and a treatment phase. The scan phase we'd use generally or globally around the area. So let's say with this Achilles tendinopathy, we'd be looking at kind of below the knee, like kind of knee to ankle. So we scan through all of that, and what that does is that decreases some of the swelling, decreases some of the pain, and improves blood flow and healing rate within the areas that are targeted. So if we're looking at, for example, we might often see that there's increased tension through the anterior compartment of the shin. As that starts to relax, we realize that there's less tension being brought into the posterior compartment of the shin. Likewise, if we've done our stretches beforehand or mobilization beforehand to the anterior thigh, that will then help the hips come back into nice position and take some slack out of that posterior chain. After the scan phase, we'll come in, we'll use the localized treatment. So we'll go to maybe 6 points. And depending where you are with the person, so if it's in the beginning of the treatment protocol, what we'd probably do is we'd have them either completely stationary or as you're kind of treating the ankle, you might do some passive movement through, just trying to get a little bit more depth and get more energy into the tissue. And then perhaps as you're getting towards the end of the treatment course, you might have them doing active movement. So for example, they might be standing doing heel raise or something like, or a toe raise, something like that. And it's relatively easy to kind of incorporate to what you're doing. Again, I think it's quite nice because you have to be very clear with where you're going with the patient. And I think that's quite good for yourself, because you have your objectives for each treatment, and you think, well, are we here? If we listen to what the patient's actually saying, are they ready for this next step? And so as long as you're able to go nice and careful with those things, I think that makes a lot of sense. And it's wonderful just to know, hang on, if I do this, the very high probability is the patient will be feeling better. They'll decrease the swelling, they'll decrease the pain, and they'll be able to do more of their rehab. I do also use like a little bit of tape perhaps at the end as well, so kinesio taping. So it all kind of works together as part of this kind of unified whole. So the patient, really knows that they're being looked after. They can really feel the change and see the difference in how they're getting on with things. And so that unifies it really nicely, so they feel very well cared for. So with chronic conditions, what we're looking to do is to understand both why the person has got into that chronic condition in the first place. So what is it that from their structure, what is it from their movement patterns, etc., behavioral patterns that have got them into that, and then how we can get them out of that as in a nice progressive and periodized way. So the great thing that we get with this, with the laser to kind of reduce the pain, so this chronic pain, and when people have been in chronic pain, they have all kinds of changes within the central nervous system, sensitization, etc. And then we also have kind of fear of pain as well. And so for me, the really great thing that we get with the MLS laser is that when you can take away that pain, you give the person belief that something's getting better. And so when you give them exercise, when you give them rehab stuff, they are so much more likely to do it. And typically, if the condition has been there for a while, so osteoarthritis of the neck or something like that, then there will be a longer treatment. And people, they understand that, something's been going on for a long time. It will generally take a long time or a longer time for them to be treated. So, we're looking more at the kind of 6 to 8 sessions as opposed to 4 to 6. Again, that's just being very, very general. If we're looking at something like neck osteoarthritis, then of course we want to deal with what's happening below the neck with mobilization, manipulation, things like that. And then when we actually come into the neck itself, we're trying to reduce the amount of tension that the neck musculature is putting into the joints by compressing them. So we're getting that to loosen off. And again, this is one of the things I found the MLS to be absolutely fantastic for. Is really helping the scalenes and the posterior neck musculature to relax. And so again, we would be nice and careful with that. We wouldn't put in huge amounts of energy, so we'd probably decrease the intensity a little bit. And that's one of the settings you can put in here. We would then always make sure that at the end of the treatment, we'd do some active movement with the patient to make sure that they're kind of happy with that new range of motion. And again, that's one of those wonderful things when they're kind of going, oh, that feels nice. And again, of course, everything has to be nicely aligned as they're doing it. But you're training this new kind of kinesthetic process of them knowing where they are. So that's absolutely lovely to see, and having this change in pain for them. Oh wow, I can really get better. That's just great to see. So if we look at something like a very acute, very recent ankle sprain, this is one of the things where the ability to decrease swelling, decrease pain, and speed up healing is absolutely one of the things that the laser does so well. So what we'd look to do is, to say someone sprained their ankle running, doing field sport, whatever it is, you'd get them in, you'd obviously do your assessment, see what's happened, assuming everything's relatively standard. You would come in, you'd scan the calf with the general scan phase, which would change that lymphatic drainage by this vasodilation process that the nitric oxide gets. We'd have a decrease in the pain as well, of course. And then when you're actually into the area of damage to the ligaments, that's where you'll be doing the individual work. And again, what's great with that is you know that it's going to be speeding up the healing process, and in a way that nothing else really can. So, you know, your contrast work isn't going to do it in the same way. Your shockwave isn't going to do it in the same way. You know, obviously you've got to have good nutrition, you've got to have good recuperation, sleep, etc. But this is the thing which just takes it to the next level. And as you've got that person in maybe 3 times in the first week, 2 times the second week, 2 to 1 time in the third week, you'll see this very significant improvement in movement pattern and decrease in pain. Obviously, they have to be very careful to make sure that they're not going to re-injure it, but the great thing about that is you can start doing your proprioceptive work, your balance work very early on, and that makes a huge difference in decreasing the likelihood of them re-injuring themselves, which is the main thing we want to be looking for. So as you can kind of go through that, you know, you're seeing them relatively regularly, but they get out of it really quickly, and that gives them less of a chance to re-injure themselves, less of a chance to adopt bad movement patterns, and more of a chance to be able to get back to sport or to activity in a solid, good movement pattern. So with the biostimulation mode, the greatest thing I've seen it with is with non-diabetic leg ulcers. So it was fantastic to kind of see quite a big, juicy and deep leg ulcer just kind of knitting together over a very short period of time. So it was weeks rather than months. And yeah, the patients I've used it with have been spectacularly happy because they've had them before and they know what it's like. And they're just constantly going into the GP surgery to get the wounds dressed and dressing exchanged and so forth. So to get them out of that, you know, the itchy, the unpleasantness, all of those things, and to get them, you know, feeling comfortable and happy with the legs again has been absolutely fantastic. Okay, so what do we actually do when we're using the laser? So what we actually have is the computer here, and we have the handpiece here. So as you're treating people, you'd have your glasses on. So I haven't turned it on, which is why I don't have the glasses on. What we do if we're treating something, so let's say we're treating you know, medial epicondylitis, we'd start off with what's called a scan phase, and that's where you're treating everything around the area to improve fluid exchange, lymphatic drainage, etc. This will create vasodilation, which will help that. There will also be increase in ATP production, and there'll be a decrease in pain as well. So we'd probably be using like this general kind of scan. So let's say we're into here, so we'd probably just work through at that kind of pace. And what's great is actually on the computer itself, there's a diagram, and it'll literally show you with colored lines where you should be going into the area. So we'd be doing something like that. And again, the patient doesn't necessarily have to do any active or passive movement or anything else where you would be doing passive movement to the patient. They can just literally kind of stay there like that. And we're using it at, you know, something like that kind of pace. It's relatively relaxing for you. It's something there's no stress or kind of trauma to yourself as you're doing it. You know, it's not like you're doing mobilizations or frictions or something like that. So that's quite good. So once you've done that, and that would be, say, a couple of minutes, then you come in and treat the kind of specific points. So let's say it's this medial epicondylitis. You'd probably treat around the origin and possibly through the belly as well. So you'd probably be something like that. And then depending on where you are in the treatment program, so let's say we're towards the end of the treatment program, where you get 2 or 3 sessions into it with the patient, you would get the patient to do some active movement like that. So they're getting the muscle to do the movement, and you're as the laser is coming into the muscle, it's going through more tissue because of that movement. So you're getting a nice movement through there. You come to a couple more. So if the scan phase was 2 or 3 minutes, you probably have something similar, but you'd probably be breaking it down into, let's say, 6 points at 30 seconds each or something like that. And you can either get them, as I said before, to do active passive movement or just for it to be completely still. When that's finished, you probably notice that the tissue will be certainly much looser. Pain should have decreased. You wouldn't necessarily feel any heat or any swelling or any kind of redness or anything else like that, as you might with some other things. But you would probably see a decrease in swelling and edema. Yeah, if it's something like, like your osteoarthritic knuckles, or, swollen ankle or swollen knee, it's really obvious, actually. For something like a medial epicondylitis, yeah, you probably see something. But that's the kind of pace that we'd be doing it with. That's how it generally kind of work.